Hi, my name is JJ Bivona. I'm a doctoral candidate at the University of Vermont Larner College of Medicine. This is the second video in our COVID-19 Explained Understanding the Pandemic with Basic Science series. Last time, we discussed the technique behind nasal swab testing that tells scientists and physicians if someone is currently infected with SARS-CoV-2, the virus that causes COVID-19. Today, we'll discuss serological or antibody tests. Serological tests are not used to tell scientists and physicians if someone is currently infected with SARS-CoV-2. Rather, they can help determine if someone was previously infected with the virus. To learn how these tests work, we must first understand how our bodies fight diseases and viruses. When functioning correctly, a person's immune system will protect them against harmful pathogens such as bacteria or viruses. The SARS-CoV-2 virus infects people by utilizing a protein on its surface called the spike protein. This viral spike protein allows SARS-CoV-2 to attach to human cells to ultimately infect them and rapidly create more copies of itself. When this happens, the immune system will attempt to fight back against the virus through several processes. One way is through the production of special proteins called antibodies, which specifically target the spike protein of SARS-CoV-2. About a week after a person's immune system identifies an infection, a group of white blood cells called B cells begin to make and secrete antibodies. These proteins recognize specific pathogens and can protect us from future infection. Antibodies fight infection by attaching to the pathogen, blocking it from entering healthy cells, and signaling to other immune cells to destroy it. Using the knowledge of how our bodies respond to infection, how can scientists and physicians determine if someone has been exposed to SARS-CoV-2? The serological tests that scientists use detect antibodies circulating in your blood that recognize the viral spike protein. Although there are a few different techniques used in serological tests, today we'll discuss a widely used technique called an enzyme-linked immunosorbent assay, also known as an ELISA. To start the ELISA, scientists stick synthetic viral protein, identical to the SARS-CoV-2 spike protein, to the bottom of a plastic plate. A patient's blood is then drawn and a component of it called serum is extracted. The serum is then added to the plate on top of the spike protein. If a person was previously infected with SARS-CoV-2, antibodies against the virus's spike protein will be present in the serum sample. These antibodies will bind strongly to the spike protein. Other antibodies in the serum that are not specific to SARS-CoV-2, such as those from previous infections or vaccinations, will not be able to recognize the SARS-CoV-2 spike protein and will not attach to it. Next, the serum is washed away, leaving only antibodies capable of recognizing SARS-CoV-2 spike protein attached. This process is like trying to find the matching lid for a Tupperware. Your cabinet has a stack of lids, and you often have to try 2 or 3 before you get the one that fits. Here, the SARS-CoV-2 spike protein is the Tupperware, and the different antibodies in your serum are the lids. If a person has not been previously infected with SARS-CoV-2, the serum will not contain antibodies that bind strongly to the spike protein, and thus will be washed away. In contrast, the serum from previously infected people will have large quantities of antibodies that bind strongly to the spike protein and thus are retained on the plate. Next, scientists add a detection antibody to the plate, which attaches directly to any remaining human antibodies. Since the only antibodies that remain are those anchored to the spike protein, the detection antibody binds to those. The detection antibody has an enzyme linked to it, which upon the addition of a developing chemical, turns the plate blue. Therefore, we know a person has SARS-CoV-2 antibodies if the color of the plate changes from clear to blue. If there are no SARS-CoV-2 antibodies, the color change will not happen. Finally, an acid is added to the plate, stopping the reaction between the enzyme on the developing antibody and the developing chemical, in the process changing any blue wells to yellow. Scientists can determine the amount of SARS-CoV-2 antibodies in a patient's serum by putting the plate into a machine that determines the intensity of the yellow color. Here, brighter samples contain more antibodies against the virus. While serological tests are important for determining previous exposure history to SARS-CoV-2, there are some limitations. For instance, Even though antibody tests can help scientists and physicians determine if someone has previously been infected with SARS-CoV-2, they cannot tell us if these antibodies are protective from future exposure to the virus, or how long a person's immune system will continue to make antibodies against the virus. Serological tests help epidemiologists estimate how many people in the population have been infected. This is important in determining the extent of community spread, since many people with COVID-19 do not have symptoms and do not get tested for the virus when they have it.